Now in corneal disorders, we will discuss degenerations of the cornea. Degeneration, these are the acquired condition which cause the opacity of the cornea, okay? And they are of multiple types. The first one is the arcus senilis. Arcus senilis, it is the deposition of lipids in the cornea. In the peripheral cornea, there will be the deposition of lipids, okay? Due to old age, and it follows a special pattern. This deposition is occurring in the peripheral cornea in a circular region, but there will be a clear cornea between the opacity, okay, between the opacity and the limbus. There will be a clear cornea, okay. So this is the deposition of lipids in the peripheral cornea, but there is a clear cornea between the limbus and the opacity. This is called arcus senilis. When this occurs in a young individual, it is then called arcus juvenilis, and it is mostly occur in a young individual due to dyslipidemia. Okay. The second one is the lipid keratopathy. Lipid keratopathy is also the deposition of lipids in the cornea, but for different reasons. Okay. It can be primary or secondary. In primary lipid keratopathy, we do not know the exact reason or etiology, but there is the deposition of lipids, okay? We do not know that why and how the lipids are deposited in the cornea. In the secondary lipid keratopathy, this deposition of lipids occurs as we know that when there is the problem with the cornea such as keratitis, when there is the chronic inflammation, if it is not treated, there will be the vascularity, okay? And there will be the vascularity over the cornea, okay? And this vascularity, these new vasculature, they are leaky. They will release the lipids into the cornea, okay? And will cause lipid keratopathy, the deposition of lipids in the cornea because of the leaky vasculature. This is called secondary lipid keratopathy. Now the third degenerative condition is the band keratopathy. And band keratopathy, it is the deposition of calcium salts in the cornea, especially in the superficial part of the cornea such as epithelium, Bowman's layer and superficial stroma. Okay, when in these regions, when the calcium salts they are deposited, this is called band keratopathy. Okay. Band keratopathy, it can be occur metabolically or it can occur dystropically. Metabolic calcification means that when there is some problem with the calcium metabolism, but they are saying that the metabolic calcification is rare. Most band keratopathy is occurring due to dystrophic calcification. Dystrophic calcification means when there is some degeneration and destruction, and we know that in the process of necrosis there is the deposition of calcium. So this deposition of calcium due to the process of necrosis and this debris, this is called dystrophic calcification, and it can cause band keratopathy. Okay, it can be treated with calcium chelating agents such as ethylene diamine tetraacetic acid. Okay. So it can be treated with EDTA, which is in simple words ethylene diamine tetraacetic acid. Okay, EDTA. It is the calcium chelating agent. Now we have the fourth one is the spheroidal degeneration. And spheroidal degeneration, it is mostly occurring in men. Okay, mostly occurring in men which are exposed to dry, hot, and environment in which the ultraviolet light directly hit the cornea. So, due to the dry, hot and ultraviolet light, there will be destruction, especially in this interior region of the cornea. There will be destruction of the collagen fibers and matrix. So, when the matrix is the proteoglycans in between these collagen fibers, when there is the destruction and due to these environments, what will happen? There will be cross-linking. Okay. the cross-linking will occur due to the harsh environment between the collagen fibers and the matrix. And this cross-linking will produce special type of granules. Okay, granules will be produced. Granules will be produced, and these granules are golden yellow granules on the surface of cornea, which are produced due to the cross-linking of the collagen fibers and the matrix, which produces visible granules, golden yellow granules on the surface of cornea. Okay, this is called spheroidal degeneration. Now, the last one of degenerative condition is the Salzmann Nodular Degeneration. Salzmann Nodular Degeneration is due to the chronic keratitis. As we have discussed in the previous video, many types of keratitis. So when the inflammation of cornea is chronic, what will happen? As I have told you before, that these keratocytes, these are the cells which deposit these collagen fibers, which produces these collagen fibers. So when the inflammation is chronic, what will happen? These keratocytes will produce these collagen fibers in a non-oriented pattern, excessively in a non-oriented pattern. So when the collagen fibers, when they are not normally oriented, what will happen? These will appear on the surface of cornea as a nodule, okay, as a white nodularity. Due to the non-orientation and irregular arrangement of the collagen fibers due to the chronic inflammation, there will be the appearance of nodularity on the cornea, okay, whitish, grayish or whitish nodularity on the cornea, and this nodularity is produced due to the irregular arrangement of the collagen fibers. This is called Salzmann Nodular Degeneration, and it is mostly occurring in the trachoma. Okay. So these were few of the degenerative conditions for the cornea.